First-line treatment for sickle cell disease. A 5-year-old child with a history of sickle cell disease presents to the emergency department with acute pain in the abdomen and chest. The child is febrile, and lab results show hemoglobin S with an elevated white blood cell count. Which of the following is the most appropriate first-line treatment to manage this patient's acute pain episode and prevent further complications? A. Hydroxyurea. B. Blood transfusion. C. Pain management with opioids and hydration. D. Corticosteroids. E. Antibiotics and fluids. Answer: C. Pain management with opioids and hydration. Explanation: the first-line treatment for an acute pain crisis in sickle cell disease is pain management with opioids or other analgesics depending on severity and hydration. Pain crises, also known as vaso-occlusive crises, are one of the hallmark symptoms of sickle cell disease. The goal is to manage pain and rehydrate the patient to help reduce the sickling of red blood cells. Hydroxyurea, A, is used as a long-term therapy to reduce the frequency of sickle cell crises, but is not the first-line treatment for acute pain episodes. Blood transfusions, B, may be necessary for severe cases or chronic management, but are not typically the first-line intervention for an uncomplicated pain crisis. Corticosteroids, D, are not typically used in the acute management of sickle cell crises. Antibiotics and fluids, E, would be appropriate if the child presents with infection or sepsis, but in the case of isolated acute pain, pain management and hydration are prioritized. First-line treatment for Bloom syndrome. Question: a 4-year-old child presents with growth retardation, light sensitivity, and a family history of similar symptoms. The child also has a small head size, microcephaly, and is prone to infections. Genetic testing reveals a mutation in the BLM gene, confirming a diagnosis of Bloom syndrome. Which of the following is the most appropriate first-line treatment for managing this patient's condition? A. High-dose corticosteroids. B. Regular blood transfusions. C. Avoidance of UV light exposure and sun protection. D. Bone marrow transplant. E. Chemotherapy. Answer: C. Avoidance of UV light exposure and sun protection. Explanation: Bloom syndrome is characterized by a mutation in the BLM gene, leading to chromosomal instability and an increased risk of cancers, as well as other symptoms such as microcephaly and photosensitivity. The most important first-line management for patients with Bloom syndrome is strict avoidance of UV light exposure and sun protection to prevent skin damage and reduce the risk of skin cancer. This involves using broad-spectrum sunscreens, protective clothing, and avoiding sun exposure. High-dose corticosteroids, A, are not a standard treatment for Bloom syndrome. Regular blood transfusions, B, are not typically used in Bloom syndrome unless there is associated bone marrow failure, which is not a hallmark feature of this disorder. Bone marrow transplant, D, may be considered in cases of bone marrow failure, but it is not the first-line treatment for most Bloom syndrome patients. Chemotherapy, E, is not a first-line treatment for Bloom syndrome. It is used in cancer treatment, which Bloom syndrome patients are at risk for, but it is not used prophylactically in this case. This question: first-line treatment for Tay-Sachs disease. Question: a 3-month-old infant is brought to the clinic due to developmental delay and muscle weakness. On examination, the baby exhibits a cherry red spot on the retina and has an exaggerated startle response. Genetic testing confirms a Hex A gene mutation, leading to a deficiency in hexosaminidase A. Which of the following is the most appropriate first-line treatment for this patient's condition? A. Bone marrow transplant. B. Enzyme replacement therapy, ERT. C. Allogeneic stem cell transplant. D. Supportive care and symptom management. E. Gene therapy with CRISPR-Cas9. Answer: D. Supportive care and symptom management. Explanation: Tay-Sachs disease is a lysosomal storage disorder caused by a deficiency in hexosaminidase A, which leads to the accumulation of GM2 ganglioside in neurons, resulting in neurodegeneration. Unfortunately, there is currently no cure for Tay-Sachs disease. The first-line treatment is primarily supportive care, aimed at managing symptoms and improving quality of life. This includes physical therapy, respiratory support, and nutritional management. Enzyme replacement therapy, ERT, B is not currently available for Tay-Sachs disease. While ERT is used for some other lysosomal storage diseases, it is not approved for Tay-Sachs. Bone marrow transplant A and allogeneic stem cell transplant C have been studied but are not considered standard treatments for Tay-Sachs as they have limited effectiveness in halting neurological decline. Gene therapy, E, including CRISPR-Cas9, is an emerging field but is not yet a first-line or standard treatment for Tay-Sachs disease. This question